One of the hardest parts, I think, about being a patient is knowing when I should go into the doctor, when things are bad enough that I should be worried and that I should seek higher care than just taking care of myself. And with it being cold and flu season, it's about that time for that to be constantly on my mind about, oh, I feel awful this morning, but is it bad enough that the doctor will be able to do anything for me? Or should I just keep up with my over the counters? So, my name is Dr. Rachel Langley, and I work at Pine Ridge Family Medicine here in Colorado Springs. So, I admit I have a little bit of an in on whether the doctor will see me. I can just walk down the hallway and say, this is what's going on, Dr. V. So, let me pass on some of this knowledge to you, my YouTube crowd. So the number one thing that people come to me for their colds is probably for antibiotics to see whether it could be a bacterial infection and whether they should be on antibiotics. And for most healthy adults without immune system problems, even if it is a bacterial infection, they can probably bounce back from it. But being able to tell one way or the other is useful sometimes. So here's some of the basic criteria that I often go by. I mean, every situation is a little bit different. Every person that I meet is a little bit different. So I'm definitely not following these strict lines every single time. But this is what I generally use to guide my decisions. So things that make me think that what's going on is a bacterial. Number one is if things are getting better, and then start getting worse. This kind of goes in with this last one, that if a cold has been going on for a long time and really not improving over the course of 10 days, that makes me worried that it might be bacterial. And also, as the first one says, if things seem like they were getting better and then all of a sudden it feels like you got hit by a truck, that makes me think bacterial as well. Also, having a fever, by definition, has to be higher than 100.5. Anything less is not a fever. That's not the only thing that I'm going to be looking for. If you just have a fever, lots of viral infections, the flu, for example, the flu is a virus, and that often has a pretty bad fever. But that's just one of the things that I'll use for thinking about whether you might benefit from antibiotics. Strep throat is a bacteria in your throat that we treat with antibiotics regularly. The reason that we treat it with antibiotics is probably not what you think, though. We're not treating you because your throat hurts so much with antibiotics, but because once in a very small amount of times, once you have strep throat, and if you don't get treated with antibiotics, the bacteria can migrate to your heart and cause issues down the road. So that's actually why we're treating you with the antibiotics, because most likely you're going to be able to fight off that strep bacteria easily by yourself. But we're worried about that itty bitty possibility in the future of it causing heart issues. So we treat you with the antibiotics. So there's a possibility that as bacterial resistance becomes more and more of a thing, I've often wondered to myself whether we'll stop treating strep throat with antibiotics. For now, we're still treating with antibiotics, but it's a possibility for the future because bacterial resistance to antibiotics is a real thing and it's a scary thing. Another thing that is commonly bacterial is ear infections in adults. In kids, it's a different story. That's most likely viral, and if we can put off antibiotics for a couple days and see if it gets better with just Tylenol and ibuprofen treating the pain, that's the best for most kids. But actually for most adults that have pain on the inside of their ears, that means that if you wiggle the outside of your ear like that, that's not where most of the pain is coming from. If it hurts when you wiggle the outside of your ear, it's most likely an external ear infection, also called swimmer's ear, and usually responds well to drops. But if it's on the inside of the ear, oh, it's so painful to have ear pain like that. Take your ibuprofen, take your Tylenol, and then come in and see your doctor because you most likely, if you're an adult, could benefit from some antibiotics because those tend to be bacterial. And then I also didn't cover this, if you'll notice, the Centur criteria for strep throat. I almost forgot about that. Centur criteria are 4 things that make me really think something is strep throat and could benefit from antibiotics. And in fact, sometimes if you have all 4, I won't even do the rapid strep test because I'm going to treat you with antibiotics anyway. If you do not have a cough, if you have a fever greater than 100.5, if you have white gunk hanging on your tonsils back there, the tonsils are the craggy looking things in the back of your throat. Sometimes they're huge, sometimes they're small. They're back there. If you had them removed, they're not. Good call. And finally, if you also have lymphadenopathy, lymph nodes that are lumpy on your neck and sometimes tender, painful. If you have those 4 things, that really makes me think that you have strep throat. And sometimes I'll just put you on antibiotics without doing the rapid strep. So those are the big things that I treat as bacterial signs. Again, I'm talking to patients one-on-one. I'm seeing what's going on with them. I'm looking over at you. I'm seeing, number one, if you look just awful, to be honest, that's one of the big things that I go by. If you're dressed normally and talking normally and acting normally, probably you're going to be okay with just the over-the-counters. So what kind of over-the-counters do I like to recommend? I love, love, love ibuprofen. It's amazingly helpful for sore throat. It's not something that I think of when I have a sore throat all the time, because I think of, oh, I'll do the lozenges, I'll do the sprays in the back of my throat, and those can be helpful, but honestly, ibuprofen is the best. And ibuprofen also helps with that achiness and pains and fevers and chills. Oh, I don't know how people have fevers and survive without ibuprofen. I think it's amazing. And if you are having fevers like that and feeling achy like that, I'll even recommend to just never let yourself get to the point where you're off of meds and feeling that way, because it's so miserable, and we have great medicines for that. So I recommend to take ibuprofen, then 4 hours later take Tylenol, then 4 hours later take ibuprofen, then 4 hours later take Tylenol. I usually don't wake up in the middle of the night just to take the medicine, but I'm eager to take that as soon as I wake up in the morning to make sure that I'm feeling as well as I can with that awful viral cold. For congestion, I really like guaifenesin, also called Mucinex. That tends to thin out the mucus so you can cough it up so it can be blown out of your nose, out of your sinuses. That can be helpful. I also really like Sudafed. Some people don't like Sudafed or pseudoephedrine. That's the one that you have to show your ID at the counter to get. So it's can sometimes cause heart palpitations or feel like you're wide awake, feel like you're caffeinated. Some people don't like that, but I really like it. I like that it dries out everything so effectively in my nose, in my chest, everywhere. It tends to have bad effects on breastfeeding. So if you're a breastfeeding mom, it can definitely decrease your milk supply. So it's one to stay away from. Other medications that I like for my cold, I really like Afrin. I've been doing that a lot recently. Afrin is actually a nasal spray that I give back when I was in the military. I would give it to pilots, and they would be required to fly with Afrin just in case they had a sinus block or an ear block while they were flying, because it tended to cause problems and pain as they were landing. So if they started to have that, we wanted them to be able to land safely. So they would fly with Afrin so they could spray it on each side of their nose, get their ears cleared, get their sinuses clear, get rid of that pain that fast, and be able to land that plane safely and keep everyone on board safe. So I love Afrin. I've been doing it since my military days, I admit. But the important thing to know about Afrin, or oxymetazoline, is the real name for it. So I love brand name. I love generic. So get whatever's cheapest, because it all works. So you do 2 sprays on each nostril twice a day, morning and evening, for 3 days. The 3 days is an important part, because it is so effective that your nose can get used to the oxymetazoline and actually just be swollen all the time until you use the Afrin. So that's a problem. That's kind of like a nose addiction, as it were. But when your nose doesn't really get addicted, it just gets swollen unless you use the Afrin. And that's a bad thing, because you don't want to have to use the Afrin every day. So you can only use the Afrin safely for 3 days or 6 dosages. And then usually if you still have a cold, I'd give it like 2-3 more days off of the Afrin. And if it's still bothering you, you could go on for another 3 days. And that's a reasonable thing to do. But man, that really clears your ears from that full sensation. It helps drain your sinuses. It helps clear your nose. I love Afrin. I'm not a big fan of the combo medications, the ones that you take during the day, the ones that you take during the night. Those tend to have 5-10 medications all in them that they're not necessarily for symptoms that you're having. So, and I don't like taking medicine when you don't have to, when you don't even benefit from it. So I know it can seem like you're taking a gazillion different kinds of medications for your cough and cold symptoms, but actually those day and nighttime formulations have a ton of medicine. You just don't see it because you're not taking the separate pills. So you might be taking medicine that you don't need. Those frequently have Benadryl to help you get to sleep at night. That's a great thing to take on its own. As for the cough, man, the cough is the hardest part of a cold, isn't it? and it can last for 4 to 6 weeks and still be normal. Ugh, it's not fair. 4 to 6 weeks is a really long time to have a cough. And we have tons of medicines out there for cough. There's a reason for that. None of them really work very well. A spoonful of honey works just as well as all those cough syrups out there. Ugh. There is a prescription cough medication that some people swear by. I think about half my patients say that it works, and the other half says it's completely worthless. I've tried them. I don't think they're very good. They're called benzonatate, or Tessalon pearls is another name for them. So that's another option to try if you're desperate to get rid of that cough to get some relief. But mostly I recommend a spoonful of honey. So that's what I take for my colds personally, and that's how I try to make decisions about whether antibiotics are useful or not. Hopefully you've got some questions or comments you can leave down there. I'll read them, and if you ever have any questions, especially if you belong to Pine Ridge Family Medicine, of course, please come in. That's the whole point of direct primary care, is that we can work with you and see you when you want to be seen or have any worries at all. We love taking care of our patients. Please call us, text us, email us, or become a member of our practice so that we can form that relationship with you and take care of you. Thanks for watching.